let's talk about Gauteng and COVID-19. There was an update from the Provincial Command Council a little earlier today. Infections are increasing in the province. Hospitals are already under quite a bit of pressure, and the Gauteng Premier is really worried. Let's break down the numbers and find out exactly what they're telling us. I'm joined by Professor Bruce Mellado. Now, he's a member of the committee that leads the COVID-19 modelling for Gauteng. He also advises the Premier, and he's a senior researcher at eNCA Labs. Good evening, Prof. Thank you so much for your time. You are able to look at the numbers and see the story behind the numbers. We know that the numbers are going up and up in Gauteng. We know infections are up, but we also know hospitalisations are up. What is the picture and the story that those numbers are telling you about how bad the third wave is going to be and where we are in the process?
But first of all, thanks for having me. You're completely correct. We monitor the data on a daily basis. We perform analytics, and we try to make projections and modeling to help policymakers manage the pandemic. So as you correctly pointed out, we are observing a sustained increase in the number of cases. We've had 4 weeks in a row where a number of very important indicators have been increasing steadily. And that includes number of cases, mortality, excess mortality, hospitalization, different types of hospitalizations. We also look at mobility, hotspots, and so on and so forth. So right now we do have a comprehensive picture that all of these indicators are consistent with the notion of us being in the middle of a resurgence.
We're looking nationally at a picture, I think the last few days, of over 5,000 infections a day. And if I'm not mistaken, and you're the numbers person, not me, about 3,000 of those, roughly, are attributed to Gauteng. Is it fair to say that, in a way, Gauteng is actually driving the third wave?
So you're right that in the past 2 days we've had 2 daily occurrences with 3,000 cases a day. That's certainly quite significant for just one province. We've seen in other waves that other provinces started before others, other provinces lag behind. So it's not like one province is responsible for the entire wave, but we have seen in the past that waves behave differently. They start in different places. They move from one place to the other. In this time around, we've had the Free State, Northern Cape, and now Northwest being technically in the third wave, and because of mobility, obviously, there's a lot of people coming and going from and to Gauteng. Obviously, those numbers will have started to propagate in the province. On the other hand, we've also had districts like Citibank and all its sub-districts that have already been displaying large numbers since the inception of the third wave. So it's a complicated picture where mobility drives a lot of the numbers.
Is the third wave in Gauteng going to be worse than the second wave was in Gauteng?
We have provided projections to policymakers to ascertain that the resources are going to be in place when the peak takes place. According to our estimates, we should be able to see the peak within about a month's time, a week, give or take. So we're certainly going to see increases in the numbers throughout June and possibly beginning of July. In terms of whether the wave will be worse or better than the second wave, that's obviously something that can be debated. What we provide to the province is basically the worst case scenario. So how many active cases can the province have, given the fact that we have already infected a significant fraction of the population? So those numbers have been provided to the province. In fact, these have been echoed by the Premier today. So we've indicated that we can have, in the worst case scenario, about 80,000 active cases, which is a very large number.
That does sound really high, and it sounds, as from what you're saying, you expect the peak in about a month. So that takes us into early July. Obviously, infections can be controlled if people social distance, so there's a certain amount of control. But when it comes to deaths, that depends often quite directly on how well equipped our hospitals are. We are sitting with a situation in Johannesburg where 2, 3, if not more of our hospitals have erratic or no water supply. One of the largest hospitals in Johannesburg, Charlotte Maxeke, is not actually open because of the fire in April. Have you modelled for how that could impact on the deaths?
So the situation on the ground is as I understand, well understood in terms of these deficiencies you correctly are pointing to. The policymakers, the Office of the Premier, is very much aware of the modeling, the projections, what is the worst case scenario, what is the average scenario. So based on the numbers we've given to them, of course, they act, and they're acting quite swiftly. I believe the Premier has been quite eloquent about the action that province has taken in order to remedy these deficiencies, because as we are going towards a peak, however fast or slow, it's very clear that we need all the resources at our disposal to deal with the situation. So what the situation we're at now is that policymakers are very much aware of what is the worst case scenario, and based on that, they've acted in order to remedy the situation, to improve the situation with the water supply to some of the hospitals, and to open some of the wards in the hospital you've just alluded to.
So you're not able to predict how that might, if it's not fixed, might impact deaths?
We are, certainly, because we do know what the occupancy of those hospitals correspond to. But of course, what we really want to do, and what the province really wants to do, is to remedy the situation as much as possible.
We know they do.
Before the peak is reached.
Yeah, so that's like a month to sort things out. You mentioned a figure of 80,000 active cases that you are predicting and modelling. Would that be at the peak?
Yes, that would be the peak. That's the worst case scenario.
Worst case.
Okay, and that doesn't mean that we're going to reach that. I mean, it's highly unlikely that we'll reach 80,000 cases based on the experience we've had in the first and the second waves. But the province knows that that's the number that they have to be ready for.
What was the worst of our peak for wave 2?
For wave 2, we predicted the worst case scenario to be around 120,000 cases. So certainly the worst case scenario now is somewhat better than the second wave, and that has to do with the fact that we already have infected a lot of people who have already developed some sort of defense against the virus.
So what did it end up being? You predicted it could have got as bad as 120,000 for the second wave at peak in Gauteng. What was it actually in the end?
It was significantly less, because these worst case scenarios are basically built on the assumption that that wave is going to infect anybody else who hasn't been infected. As we know, because of societal reactions and people becoming aware of the wave, people retract from social distancing. So we have never reached that, neither on the first nor the second. That's why we refer to these scenarios as pessimistic, or the worst case scenarios.
Yeah, the reason I'm trying to understand, I spoke to Professor Tulio de Oliveira, and he was saying his concern is that Gauteng is going to have a worse third wave compared to its second wave, purely because the coastal areas were hit hardest, and it wasn't as high in Gauteng as expected, so there might be more people who are susceptible. Does that factor into your modelling at all?
Yes, all that is factored into the modelling. The measurements that have been made through the seroprevalence surveys. We have an idea of how many people have been infected already. That all is taken into account when we make those predictions and those projections.
All right. So we've got 4 weeks where we should hit the peak. At this point, the Premier looked like a very worried man today. What do we need to do to prepare ourselves better at this point? I mean, are we seeing a huge uptick in testing, for example? Do you look at the rate of testing in the province? Are you looking at things like the positivity rate and what they're telling you?
Indeed, the positivity rate, as you indicate, has already increased, has surpassed 10%, which basically is consistent with the notion that we are in a resurgence. What we have to do, and the reason why the Premier was so eloquent today is because the only thing really we have left at our disposal at the moment is really our social behavior. We really need to adhere to level 2 social distancing, wear masks, and avoid congregate settings and follow all the rules and regulations. It is really within our grasp to be able to slow down the numbers and avoid spikes. What we have to avoid at all costs is very sharp and very large acceleration of the number of cases. And those are typically driven by super spreader events. And that's the reason why Level 2 rules and regulations focus on curbing large super spreader events. We're able to keep those under control. We should be able to have a relatively mild increase in number of cases so as for the healthcare system to be able to handle the continuous growth of cases.
All right, thank you so much for chatting to us this evening. We really do appreciate it. That was Professor Bruce Mellado from the Gauteng Premier's COVID-19 Advisory Committee talking to us about what the numbers are indicating. And he says that we're likely to hit the peak of our third wave here in Gauteng in about a month's time. That is early July.